we are live. We're just going to be getting rolling here in just a second. I'm going to make sure all my live streams are working. Thanks for tuning in. It definitely makes me nervous that I don't see it. Oh, there we go. Come on. Patience is a virtue. Yeah, we're good. We're good. All right, I'll turn that off. All right, so everybody, we do have a chat going. We would love for you to check in with the chat and let us know you're here or ask any questions. But we're going to get things going. So I'm going to just start up right about now and for the recording. So here we go. All right, everyone. Welcome back to The Real Hustle. I'm Doug, and I'm so glad you're here. Today, we are tackling a really big question for any entrepreneur, and that's how do you build a business that actually lasts? Something that's not just a flash in the pan. I'm not talking about a side hustle. We're talking about a real legacy, a real business that lasts decades. I see so many people investing so much time and energy into this and that, and they jump all over the place, and it seems like it just disappears in a couple of years. And we all know people like that. They're just hopping around from thing to thing. Well, tonight we're going to look at longevity and legacy, and to help me break that down and how it can be done and answer some real questions about all that, especially in the medical field, is a phenomenal guest I have with me, Dr. Mike Ewald. Mike, thanks for coming on.
Hey, thank you, Doug. Really appreciate this opportunity. Always been a huge fan of you and your wonderful wife, Sharon. So thank you.
Oh my gosh, that is humbling because Dr. Mike is a legendary man in the Juice Plus business. And I think you're going to love hearing some of the things, especially about the medical profession and how that relates to not only the Juice Plus business, but maybe how it relates to supplements and products and network marketing and things like that, and how they crisscross. So he's been able to build a successful business in Juice Plus for over 25 years. He's a doctor of chiropractic, and he's going to tell us about his journey. I'm going to ask some great questions, and we're going to figure some things out. So Dr. Mike, I'll just get it out of the way now because I'll end up just calling you Mike because we're friends.
That's fine. That's fine.
No offense, but the rest of you, if you don't know him, you got to call him Dr. Ewald from now on.
Not at all.
Not at all. All right, but we call this The Real Hustle, this podcast, because there's a reason. So let's kick it off with the elephant in the room. As a doctor, how did you reconcile? How did you get started with Juice Plus? How did you reconcile aligning with a business model, network marketing, that often has a lot of skepticism around it?
Sure. That's a great question. And I, not only a doctor, but a chiropractor. So back in 1983, kind of aged myself here, chiropractic was really looked down upon. I mean, 100 years ago, it was really, people were being put in jail, and things got better. But even in 83, people were very skeptical and very, not sure about these chiropractors. And I had built my wife and I, Karen, we built a great practice. And, I was a team chiropractor for a number of professional sports teams and spent a lot of time doing that. And it was a family practice with a focus on nutrition, not really vitamins, but just trying to get, my patients to clean up their diet and just make some basic changes. But anyhow, we had built a great practice, and I didn't want to jeopardize that in any way. And I didn't want people to think I was pushing anything on them and basically the Juice Plus salesperson. So I was very cognizant of that. And we actually had a bad experience in chiropractic college with another kind of what I thought this was, network marketing thing. And so when I was introduced to Juice Plus at that time, and long before Juice Plus, we understood the power of whole food nutrition, real food. And at the time, we were big juicers. And when someone introduced me to Juice Plus, I love the concept of real food in a capsule form. Of course, now we have a superfood. It's our core blend is in a sleeve. But I told him, I said, I like fruits and veggies in a capsule. That sounds too good to be true. I'll try your product, but I don't want anything to do with your stupid business. And that's where I was at, very skeptical. And I let him know up front that I I didn't want anything to do with whatever you were pushing on the business side of things. So that was my initial reaction. And many people, especially health professionals, very skeptical. Probably a week doesn't go by where they're, shown the latest, greatest, whatever by, whomever. But I did like the concept, and I was smart enough that if I was going to take Juice Plus, my whole family's going to take it along with me. So we registered with the company and added it to our diet. And I can't tell you I had any miraculous changes. Again, we were already eating really well, especially my wife, Karen. I learned a lot about nutrition and wellness and health in chiropractic college, but it was my wife, Karen, that really got me eating better. She leans toward the vegan side. I'm not pushing vegetarian tonight, but I was going to do whatever she was into. So we were juicing and eating well. And so consequently, I didn't notice dramatic changes. I did notice, however, like my hair and my fingernails seemed healthier. But what really impressed me was after about 2 months of eating Juice Plus, my oldest son, he was just kind of getting into adolescence and getting some acne. And it was very frustrating because I thought we were doing all the right stuff. But after a couple months of eating Juice Plus, his face cleared up. And of course, I would never say Juice Plus cures acne or anything. What we know to be true is, the body really is the cure. Your body is the cure. We just need to give it the right fuel, the right food, and, remove any kind of interference that might be happening. And things should work really well. And of course, the standard American diet is pathetic. I think 70% of the food that we consume right now is ultra processed food, which it's not food, it's poison. So, understanding that and just trying to get people to eat more fruits and vegetables, it's almost impossible, right? So Juice Plus is kind of a simple first step. And after seeing Carl, my son's response, I thought, I got to look at this more seriously. So I actually looked into the company, and we went to a conference back in 1979, really to get away from Dayton, Ohio in March. But we went to San Diego, kind of skeptical, but open. And what I saw,
that wasn't 79,
or
maybe
97.
97. I was going to say.
Okay, 79 is when I graduated from high school. Sorry.
Okay.
Or that's
You're not
when
that old.
that's when my twin brother graduated from high school.
Okay.
And I'm 4 minutes older, so you can kind of do the math. But in 1997, we went to San Diego, and to say that event has forever changed our life, it was amazing. It wasn't a lot of hype. It was just good people surrounded by a great product. And at that time, Doug, they had 3 studies behind Juice Plus, which at that time I was blown away. I'm like, wow, there's really not much. And even today, there's really not many companies that have gold standard research, validating what we can share about our products.
So when you went to that first conference in San Diego, that was 97. Was that you were just primarily you were using it personally with your family? It wasn't like a major part of your practice or anything at that point?
Correct.
Okay.
I did.
Checking it out.
And that was maybe a 4-month duration after Carl's experience. So I did start to share it with a few selective patients, in the practice. And I did see some positive changes in their life. And again, Juice Plus cures nothing, but we know that good nutrition helps everything. So I was seeing some amazing changes in people's life just by adding Juice Plus into their diet. So I did go into that conference with some belief, and I knew that this was pretty special. But it was the conference that really got me stoked, and I learned about the research there, and that's really what sets Juice Plus apart. And we could talk for a week on the research. I love the research. Of course, now they've got close to 50 published studies, all of it gold standard, meaning double blind, placebo-controlled, randomized crossover studies. Good research published in excellent peer-reviewed journals. If you're not familiar with the research behind Juice Plus, folks, that's what changed the game for me. But also at that conference, Doug, I went into that conference burnout. I was overwhelmed. I was treating a professional hockey team, a professional soccer team, and a professional semi-pro baseball team, the Dayton Dragons. They're a farm team for the Cincinnati Reds. So I was working my 50 plus hours in the office, and then I'm going to games, whenever the baseball team, whenever they return from an away trip, they wanted treated. the hockey team, I had to be there every game, and I'd go down between periods. And it wasn't a life. I was on that treadmill that had no on off switch. So we went into that conference, pretty fried. And what I got excited about was the benefit package. Juice Plus is a network marketing company, but it really has pulled some of the wonderful benefits from corporate America, and the fact that they've got a benefit package, and being self-employed at that time. Um, I couldn't afford a family health insurance policy. We had a catastrophic plan, but I thought, boy, if we could generate that, full medical, dental, disability, they've got some life insurance. I thought that would be a game changer. And Karen, my wife, what she saw was, if we could generate a little bit of extra money, maybe Mike could take an afternoon off. That was our big why at that time. We could maybe.
That is really wild to I'm sorry to interrupt you, but I
No.
just gotta say, um, it's wild because as a non-medical professional, we go to the doctor, we go to the chiropractor, we go in for visits, but you don't always think of it's kind of like when you're a kid in school and then you like see your teacher in the grocery store and you're like, oh my gosh, there's Mr. Ewald. You know what I mean? So it's like you don't realize or you don't think about it that your doctor has like a real life. They have a family, they have budget, they have bills, they're worried about healthcare too and what their income is and opportunities. I mean, so it's not, I mean, there might be like there's obviously professional ethics, but you don't take an oath to poverty, which can be a tough business. I mean, if you call it a business, I mean, I know a lot of chiropractors, they really do work a lot. I mean, when you're seeing 300 patients a week, and it's hard on your body, I would imagine too.
Oh, it's physically demanding, and I came out of school with great skills, how to be a chiropractor, and for those of you that don't know, chiropractors, we carry the same license as a family practice medical doctor. We don't prescribe medicine. We treat with alternative, natural food and diet, and really with our hands. And but I didn't learn anything about the business side of running a practice, and doctors, nurses, hospitals, it's a business. Yes, they're helping people, but the reality is it's a business, and actually now it's the biggest business in the world, healthcare, and actually sick care. But as a chiropractor, I was clueless, and I had to go to some business management courses and learn the ins and outs of how to run a practice. And much like our Juice Plus business, I had to learn systems. We had to train our people with the proper verbiage and all of that. And it was tough. It was tough. But the hours, I always tell people I'm a lot better grandpa because of Juice Plus than I was a dad. Because it was overwhelmed for me, and I just wasn't as available to my 3 kids. I've got 3 kids and now 6 grandchildren. But I was really struggling with that life balance. And but we got excited that first conference, and basically came home pretty excited to share what we had learned about Juice Plus, for sure.
So you initially I mean, this is pretty common. I mean, as we're both Juice Plus partners, you share with other chiropractors. I share with, I mean, I have chiropractors and medical doctors on our team, acupuncturists, massage therapists, physical therapists, you name it. But there is always, and there's, I think even more skepticism from medical professionals sometimes, but not because of the product, but because of the business model, of network marketing, which I find interesting because, it's almost like what I hear is like they feel concerned that they're going to be sharing a product and making money from it, and they don't feel good about that. But at the same time, when I go to my chiropractor's office, who's not sharing Juice Plus, but there's bottles of pills, I mean, or capsules or whatever, there's supplements they're selling there. At the dermatologist, when I get my yearly checkup, they have all kinds of things you can buy for your face. Medical doctors, I mean, almost every time I'm waiting in a waiting room, you see those pharmaceutical reps come in with their little bringing in lunch for the whole staff. I mean, what is the point of that? Like you said, it's the biggest business in the world. And the deal is, the pharma rep meets with the doctor and says, hey, why don't you, I notice you're prescribing blah, blah, blah. Like, maybe if you prescribe a little bit more of this, it'd be good for your patients. I mean, so it's just, I mean, I don't know how those conversations go. Actually, I want to have that interview with somebody. I'd love to know the behind the scenes, but it seems like whether they realize it or not, a lot of these medical professionals are, in fact, making money off of either recommending products to people. It's just sometimes there's different business models. Maybe they buy the supplements and put them on their shelf and then sell them for money, or maybe it's free lunches from the farmer rep or incentives from the pharmaceutical company. I have a buddy who's a doctor, and I remember him going on trips to speak at conferences about, put on by a certain pharma company. And so I don't know, it just seems strange to me that there's all of a sudden with network marketing, they're more critical of that. So I'm wondering, how did you approach that, or what advice would you even have for medical professionals who do have concerns about, this business model or the ethics of it?
Sure. And again, I did struggle with that personally, and I do agree with you, Doug. Medical doctors that are prescribing medicines, they're not getting a direct reimbursement from those medications. However, oncologists, they actually generate income by recommending chemotherapy, which is interesting. But they are making money in the fact that they're doing lab work. They're basically getting paid on their time. So they are selling something. They're selling you, hopefully, better health through prescriptions and some of the modalities
Well,
they're recommending.
they're also selling. I mean, yeah, it's for our own good. But when your dentist is sending you reminders that it's time for a cleaning, when your doctor says, "Hey, it's time for come in, let's check on this," or "Hey, go ahead and do that blood work, and I want to see you again in a couple weeks," and I'm like, "Do I really need to come into the office? Can't you just email me the results and then we'll decide whether I should come in the office?" But every time you go in the office, they're hitting that insurance company,
Yeah,
and I had and it's just crazy, some of the stuff that is charged. I had like an infection. We won't get into details, but it was kind of gross. It was right here. I ended up going to the hospital because it was bad. Um, I was in there for one night, and the bill was like $39,000 because
yeah,
of the whatever they were putting the drip that was going into me to take care of this infection was $29,000 for the prescription. And so, I mean, it's a business, not that it's bad. I mean, it's amazing what medicine can do nowadays and what doctors can do. But yeah.
yeah.
So
Ab-
what changed it for you where you got comfortable?
Well, as a chiropractor, I'm probably a little more entrepreneurial. Most of us are. Most
Yeah.
chiropractors are basically self-employed, unlike,
Hmm.
say, a medical doctor that works for a large, health organization. They pretty much are sent to patients. You don't have to do any really promoting of yourself. Obviously, you want to offer your patients the best care, but the entrepreneurial aspect probably isn't as prevalent in medicine as it is in chiropractic, because basically, as a chiropractor, I was selling myself. First
Hmm.
and foremost, people want to know if this guy's going to help me, and then secondary thing is how much is it going to cost me. So
Yeah.
my goal, I, was to make things affordable and try to give the best service possible. And as my belief in Juice Plus grew, it became a point of ethics and really unethical not to share Juice
Yeah.
Plus
Yeah.
what I know. And I make a little. I don't make a lot of money on recommending Juice Plus. We don't make, as partners, we don't generate a fortune off of selling Juice Plus. So I feel good about that. And again, I want to keep it simple. I want to give them the best tools that I've been able to determine in my toolbox. And in Juice Plus, as far as my nutritional cornerstone,
Hmm.
nutritional component, it's always what I lead with. And I've recommended things around that, but Juice Plus is what I recommend as far as a nutritional foundation for everybody.
Yeah.
Because again, we're just not eating enough plants in our diet. So it became a matter of ethics and integrity for me. And it's very affordable when you look at the quality and the variety of the produce. And then again, the research, you know, the research is really that gives me as a health professional, the confidence and the credibility to share it with others. There's no contraindications. Juice Plus is unique. It carries a food label, just like kale or broccoli. It's non-GMO, non-dairy, gluten-free, kosher certified. It carries an NSF certification, which basically tells you what is in that product, and it tests for hundreds of things that we know are bad for you. But it really is healthy fast food. So it really became just a point of integrity, and I want to offer my patients the very best. And Juice Plus has been that for the last 28 years for sure.
And so basically, and that's another thing I find interesting. I think you'll like this story. But when on our gosh, I think it was our second child, maybe I think it was our second child. Our first child, we didn't know about Juice Plus. On our second child, Sharon got pregnant, and I was at this visit too. Um, she knew about Juice Plus, so she asked the pediatrician, no, the gynecologist, hey, when he recommended, okay, so you need to be on a prenatal, and here's what you take. And she's like, okay, well, what do we know about this? What is the research? Because she had been learning about Juice Plus too, and how the fact is that a lot of these supplements aren't regulated as far as exactly what's in them and like testing them and there's not you would think there's research on all these supplements, especially things like prenatal vitamins, right? But there isn't. So the doctor said, I don't know. Here's the phone number to the company. So Sharon actually called the company and inquired about their research and the efficacy and what they found that this prenatal does with their patients. And they said, we don't have research on the product.
Yeah.
And so it makes you wonder, like, I'm not questioning these prenatals, but I don't have the same peace of mind I have about something like Juice Plus, which we know for a fact what it is, what's in it, what's on the label is the same thing that's in the bottle because it's tested for that. And also we know exactly what it does in the body because there's over 40 published research articles. So I would imagine that would influence your confidence and feeling more ethical, especially now you're rock solid, obviously, but at that time it had to be in your mind, like, this is really good. I'm going to share it, but it just feels a little weird to share it.
Yeah, a little bit. But again, I got over that real quick as I started to see, results broad spectrum. And it wasn't just in my practice. I was sharing Juice Plus with anybody and everybody that, would listen. I never pushed it, but I would, this is what I'm taking. There's a ton of science behind it. I don't know if this is for you or not, but, check out this YouTube video is how I kind of a soft sell, if I can use that word sell. We are selling something that is changing people's health for the better and their finances. I'm not afraid to say that people are generating, some great, side income. For us, this has become our primary income. We decided 10 years ago to do this mission full time. And,
so you stopped practicing 10 years ago, is it? Or
I did some vacation coverage for a while, but the last 5 years I've solely focused on this message and this mission. It's interesting, Doug. When I sold my large stressful practice, I call it, we had about 13,000 patient files that went with, at least that was my patients. My associate, she had a number as well. But that sounds like a lot, but we've been able to impact more lives with Juice Plus than I ever could have in my chiropractic practice. So, that's that compounding effect. I didn't really go into the different components of our business model, but there is a network marketing component where, you don't have to Juice Plus with thousands or even hundreds of people. We encourage people to build a team of about 25 to 30 families using Juice Plus, because we're all about service and customer care. And, we want to make sure they're having a good experience. And you don't get that, from a vitamin off a grocery store shelf.
No. And just so everybody who's watching this knows, like I said in the beginning, the Ewalds are pretty legendary in the Juice Plus community. They are founders, what we call founders. That means they're one of the main influential people that have been honored by the company as influential in this business and in the company. And Dr. Mike and Karen have been able to build a very significant business in Juice Plus. So I'm just wondering, Mike, what are some of the things? What are some of those like 3 to 5 non-negotiable, duplicatable things that have kept you guys kind of building and keeping your business strong over all these years?
Sure. And we're nothing special at all, Doug. We've surrounded ourselves with exceptional people. Is why any recognition that we've received is because of our team. We have a wonderful team, and I love that about Juice Plus. It's definitely relationship deep. I didn't necessarily have that as a sole chiropractor out in the field. I had friends, that I connected with, but if they had the latest, greatest, whatever was working for them in their practice, they probably wouldn't, share it with the guy down the street. Whereas in Juice Plus, we all pretty much play pretty well together in the sandbox. But,
Yeah.
To answer that, just like my chiropractic profession, it involved consistency and, showing up every day. This is for 90 some percent of the Juice Plus partners. This is not a full-time gig. It's a part-time, opportunity, income producing opportunity. And we could show people how to generate, an extra $500 to $1,500 a month pretty easily. But, Karen and I have decided that, this is our full-time mission, but obviously hard work, consistency. I didn't go to my practice one day a week, adjust a few people and,
Right.
check in next week. It's, it may not be an everyday thing for most people, but, consistently sharing your story really is what we encourage people to do. What Juice Plus did for you, for me, and most people know intuitively that they should be eating more fruits and vegetables. For whatever reason, they can't, they won't, they're not doing it. Well, this Juice Plus stuff might be for you. And that's how we've presented it. And that's how I was in the practice too, going back to my, not wanting to have my patients think I was the Juice Plus salesperson. I would make a strong recommendation. This is what I take. Check out the research. I don't know if this is for you or not, but if you're interested, I'd love to follow up with you maybe in the next couple of days. And in a practice setting, to preserve that doctor-patient relationship, we had a wellness coordinator that would follow up with my patients. See if you got an
Oh,
opportunity.
that's good.
And that's important because, again, I didn't want people to think every time they came in the office I was going to bug them up about Juice Plus.
Right.
I had a couple posters here and there and some empty containers in the adjusting rooms, but beyond that, it wasn't a pushy thing. But I was consistent and I worked hard and just shared consistently and I will say events in our this is an event that we're doing right now. That conference that I attended back in 1997 in San Diego, that was a huge event for us. But events are critical to our success in this business. And again, it might just be a lunch meeting or just talking to a neighbor, sharing your story consistently, either a large event or a small event. And you can you don't have to be the expert in nutrition, which I love that. I've got a little bit of background in that, but most of the folks, the driving force in our business really are stay-at-home moms or moms on a mission. You and I, Doug, we are a minority, and I love the fact that this business, you make the same amount as the men do, and in most situations, the women are dominating. And I have my opinion on that. I believe they're more concerned about the family's health. They're more intentional about helping the family eat well, and they're just more relational. And that's my opinion, but it's true. And so I love the fact that we men and women are equal in this opportunity, and that means a lot. But events are everything, and just being willing to be teachable. And that is one thing I will tell health professionals. And there's thousands of health professionals around the world recommending Juice Plus. It's the most thoroughly researched nutritional product in the world, backed by thousands of health professionals, very prestigious health professionals, I might add, sharing this product. But that's been impressive to me and giving me the confidence for sure to share. But those are some non-negotiables. We've got tried and proven system that our corporate partners have helped develop. You don't have to reinvent the wheel. But as I said, with health professionals, you got to kind of dumb it down a little bit. You don't have to spew everything you know about nutrition all over folks.
No.
Basically, you might want to eat more fruits and vegetables. And again, here's a simple way to do that. So.
Yeah. Oh man, that's gold. This the stuff you're telling us is gold. It's great advice. Something I want to focus in on as we get into the later stages of this is the fact that this is a consumable product. Okay, so I mean this is going to be more businessy. So I always feel a little weird talking about in our Juice Plus model. We don't get too business-ish, but on this podcast we want to. So I will say that there's a point of sale, and the nice thing is that it's a consumable product, and so that person that's taking Juice Plus is going to order that again, and then order it again, then order it again. I mean, I'm sure you're like us. We have customers that signed up over 20 years ago that are still on the product from one conversation 20 years ago. And in the same way, another really cool thing about this business model is that we get the opportunity to help other people, not just get healthy, but to get that secondary stream of income, because $500 a month can really change a family's budget. I mean, you can decide to go for a lot more than that if you want to, but getting going is not that difficult and can really help people out. And I think that's a great feeling. And I love the business side of this. I love the team building side of it. I love mentoring and leading and all that great stuff. But doing that has really, I'm sure, changed the way your life kind of looks as far as time freedom and what you're able to do as far as being present with the family as compared to when you were like, 50 hours a week and then you still had other responsibilities at home. Yeah. Can you speak to that a little bit about how this business model has really just changed things for you?
Sure. And this really is the sweet spot when it comes to Juice Plus and the opportunity. The products are second to none. They're the best in the world. Nothing comes close to our research and our quality of our produce. It really is amazing. And it took me a while to realize this, but basically if I wasn't treating patients, I wasn't getting paid. Right. And again, I had a great practice. I was generating great income. But if something happened to me, our income would drop significantly. And, with Juice Plus, it's not a get rich quick thing. It's more over time. But sharing consistently, it was amazing how this grew. And as a matter of fact, we came home from that first conference in San Diego and we were excited. We brought a guy in from Jack Medina. I don't know if you remember Jack.
He's sure.
Older guy. He trained Mary Lou Redden and just a really neat guy. Yeah. But anyhow, we had 19 people at that first event. And I was fairly clueless on what I was doing, but we were excited and we invited and 19 people showed up, and all of those guests, Doug, either became a partner or they signed up as a customer. And many of those folks, like you said, are still eating Juice Plus consistently. And I will tell you that if you add Juice Plus to your diet, and again, it's food, it's not a drug. It's going to take a little time to sometimes notice some benefits. But if you take it consistently, and I usually encourage people 3 to 4 months, give it 3 to 4 months, you're going to get in the habit of taking it. And what we've seen is over time, people have really made it a habit and a lifelong habit. And for the fistful of vitamin takers, which was me, I was taking about $300 worth of vitamin pills back in '83 at that time.
Really?
Yeah. And well, I just, that was what I knew at the time, but I pretty much eliminate all of my vitamins and I take my Juice Plus consistently and I try to eat well and things have worked out, really well. And my twin brother, and this is off the subject, but I've got a twin brother that, if he were standing next to me, he's definitely too short for his weight. I'll say it that way. And he's, continues to how we were raised, kind of meat and potatoes. and that's not bad, but he doesn't eat a lot of fruits and vegetables, and he's got high blood pressure, cancer, all kinds of stuff. And
Oh,
not that I'm perfect, I'm not, but
no.
it's amazing the power of Juice Plus.
Yeah.
And anyhow, sharing consistently, this thing has grown. And again, my goal has never been to have thousands of Juice Plus customers. Again, to service them properly, that would turn into a job. Um, but what I do try to do is when people are bragging about their Juice Plus, much like they did with chiropractic, I would have people very skeptical come into the office. They've tried everything else, and I thought I'd try the chiropractor and see what you guys can do. And those were my favorite patients because they were very skeptical, and I might adjust them a few times, and their headaches that they've had for 100 years go away. And of course, those people become your best referring, your favorite patients because we just fall in love with each other. And the same thing with Juice Plus. Um, I would have patients and people come back to me and say, "Hey, Dr. Mike, I love this Juice Plus stuff. Do you think my sick Aunt Sally with such and such disease would benefit from this?" And again, I never make any claims, but I say, um, Doug, it sounds like you're loving your Juice Plus, and it sounds like you want to share this with others. Why don't I have my wellness coordinator, Karen, give you a call to see if you have any questions or interest, and we can even sit down and we can kind of show you what we do. Real
Yeah.
simple, very non-threatening, and by doing that, that's where we've built in an organization that has just compounded, that compounding effect where we're in pretty much we're on every continent now, and it's amazing the network that has been created, not because of us, but because of building a network of people. And that's a really good business model.
Yeah.
I would much rather have thousands of people, generating a little bit of income versus, maybe a handful of people where you're making big money off them each time, but they can go away pretty quickly. Whereas
Right.
when you build a solid network of people consistently, you've got that reoccurring income. Some people would call it
Yeah.
residual income, but I would, reoccurring income to where if I want to take off, a few days or a few weeks or a few months, I can do that now.
Yep.
Whereas with chiropractic, for me to leave the practice for a week, that was tough. 2 weeks, that was devastating. Even though I had a couple doctors working for me, patients are finicky. They like, the way their doctor adjusts or treats them. I'll just wait for Dr. Mike to get back. And that was, the overhead didn't go away. The X-ray machine still needed to be taken care of, and all the staff, they still needed to be paid. Whereas with our Juice Plus business model, the overhead really is minimal. It costs nothing, hardly any. $52 I get is to register with the company and become a partner. But the potential, as in our case, is you can create a multi-million-dollar
I
business.
mean, that's the thing that blew me away. I'm from a non-business background myself, in the education field. And when you're a school teacher, basically, or even a school administrator, there's like this, it's funny, like people will talk about pyramid schemes and all this stuff, which is illegal. And obviously, this is not that. But there's only room at the top. Like, there's only one principal at the school. And if that means we're all
Yeah.
fighting to get that one spot, it's not like that here. And I just saw this as a way that the little guy, that's me, the little guy, could have an opportunity to have a franchise for $52 with a multi-million dollar company that's worldwide, that has the most credible product I've ever seen, with research that surpasses anything I've ever seen. Um, and it allows me to have like this business that I can grow it, and I can do as much as I want, and I can have the biggest goals I want. But at the same time, I can mentor people who just want to do a little bit, and that's okay too. So I
Mhm.
mean, I think your definition of how you shared the product, and how that person that was enjoying the product in your practice might ask about sharing it with somebody, and then the way you had a wellness coordinator, I mean, that just speaks to the integrity we were talking about tonight, having systems in place, and then just the evidence. I mean, not only you, but us too. We have a similar story. It's just the longevity of having a stable business, because it's built on, not just one person, not just one rock star. it's built on that, like you said, that old saying, I'd
Yeah,
rather earn $1 off 100 people than $100 off of one person.
exactly. And really it's an inverted pyramid.
Yeah,
We
that's
want
true.
everybody to succeed, and that may not be making, whatever thousands of dollars a month, that may be paying for your product, but it's that's one of the skepticisms in the column. It's a pyramid scheme. Don't you get paid for signing people? No, we don't get paid for signing up people.
Zero.
You can surpass whoever introduced you to Juice Plus, and as far as your team and income, I love that. It's a very ethical, very solid business model. And what company do you know that's been around for, what is it, 50, 55, 56 years now? This company's been going strong, and I just love our corporate partners. They have done so much for us. As a matter of fact, COVID was the best year in our company's history. Not too many companies can say that. And we have partners that they've invested greatly. We've got a great new computer system.
Yeah.
We're really poised for exponential growth
Oh,
with
yeah.
our amazing products. It really is a rock solid business, but it's based on integrity, and it's based on fidelity to the partner base. Our Juice Plus corporate partners, they are faithful to us, and that's why you don't see a lot of advertising on TV. We do a little bit. I know there's some copycats out there, but it's all word of mouth, person to person, sharing what we know to be true about health, and sharing this great product. And it just for me personally, it's been the best business model, because
Oh,
I
yeah.
can still make a great income, but I can also have a life too. And we've
Yeah.
done some pretty incredible things because of Juice Plus, as far as our time and our gifts, and the money that we've been able to generate through this. It really has been amazing.
That's awesome.
Well, I could go on and on about that.
Yeah, I know. And maybe we'll have to have you back, because there's a lot more we could chat about. Well, I went about twice as long as I wanted to, but it was
I'm sorry.
No, it's so good that I'll probably
Gosh.
split this into 2 episodes. I thank everybody for coming on. Mike, you just have so much wisdom and experience, and I just think it's great what you shared, and I hope that, for anybody, especially the medical professionals that are watching this and on replay or watching it live, I hope you got some vision, or even it raised some questions. Like, maybe you want to know a little more, then reach out. Reach out to the person that invited you to or shared this with you. If you stumbled upon it, reach out to me. I can get you in touch with Dr. Mike. And we have so many medical professionals that are doing this. And maybe you could learn a little bit more about how this could work for you. So, again, thanks for coming on, Mike. I just really appreciate you, man.
Well, likewise, Doug. And if you do have some health professionals that reach out to you and want to know more, I love doing connection calls or whatever, and just kind of explaining the nuts and bolts of what that looked like in our practice. Very easy to incorporate Juice Plus into any business or any practice type setting, for sure. But thank you so much, Doug. I sorry we went so long. You can tell.
No, it's great. I like that topic. I would love to do another episode of the nuts and bolts of what it looks like doing it in your practice.
Yeah, and that's easy. It's fun.
Yeah. All right,
Thank you.
great. Well, thanks everybody for coming on. You guys have a great evening.
Thank you, everyone. Thanks, Doug.